Joe said it's advantageous to be here for hands-on to go through the settings, but number one and first foremost, you can download the My Airvo 2 app.
I would download the Airvo app, AIRVO.
It'll actually take you through a tutorial. It actually does a little quiz, like it'll say set the pressures or the temperature setting at this, and it actually times you. So it's a good visual, especially if they're not here. But I would suggest that your nurses download that app, the Airvo app.
It's free, doesn't cost anything. It doesn't control the unit, but it's a training tool for them, and it has videos on it on how to change the temperature and all that. So it is a good train. So you can put it on your iPhone or your iPad, or if you want to put it on, it comes in I use iPhone. The other one is Google phones or whatever you use.
Samsung.
Yeah, Samsung. You can use that too as well. Okay. And it's a good tool for the caregiver. I mean, if you want to. But again, you have the assistance of they have an RT there for you, so he's able to get them involved.
And we do have a YouTube page, and we're close to getting our Airvo video completed. So I'll give you an example. On our oxygen equipment, our stationary oxygen concentrator is a QR code. You can scan it. It'll take you to our website. Just in case family member A was there at the setup, a week later it's a different family member, they can scan that. I mean, we'll always go out, but you can scan it. It'll take you to our website, and it has a lot of education information on there. Okay. But on the app, if we were to simulate
just
it.
like a simple.
Yeah.
Which one?
I have the 2.
Is it that one?
Yeah. And then when you actually utilize the app, it's like you're using the device.
Yeah, it has a control panel up there, and you can play around with it, go up and down, and stuff like that.
I'm just going to install it on my phone right now.
So ready? So you're gonna start, right, Sam, and then, or you want me to, or?
Yeah, no, I mean, we kind of talked when you were out, Melinda, sorry. Joe was just kind of asking what the in-service was going to entail. So I'm Sam with Home Oxygen Company. We're your DME provider. And Joe Melander is with Fisher Paykel, the manufacturer of Airvo. So we do a lot of in-services throughout the year, Joe will explain in detail what the Airvo does and the therapy it provides for the patient, as well as how the machine's used. As I mentioned to Joe, the misconception is someone can be on Airvo because it's humidification comfort for the patient. You can be on it without oxygen, okay? But to achieve the higher levels, you need supplemental oxygen, so I brought a stationary concentrator. But that's one of the biggest misconceptions is you have to bleed in oxygen to the Airvo. You do not. So, but
yeah. So I mean, when it comes to the Airvo in hospice, it's a totally different ball game than when they use stuff in the hospital. Okay, it's all about comfort. This is what we're going to. When it comes to Airvo in this hospice setting, it's all about comfort. So that's what the goal of this product is for that. So, and there's 3 things that the Airvo does, okay? Number 1, it provides high levels of heated humidification, okay? Now, I'm not gonna get all wonky and all this, I just kind of want to give you guys a little base round of it, but we can get up to 37 degrees on this, and it'll have 100% saturated gas, about 44 milligrams of absolute humidity in it. And by doing that, it's mimicking when you normally take in a breath, by the time it gets down to your lungs and your cranium, it's at 37 degrees and 44 milligrams of absolute humidity. So in saying that, we're able to provide that at the entry point, right here at the end of the hose. So by doing that, we're making up that deficit for that patient, right? We're actually making the therapy a lot more comfortable for that patient too as well. And they're on oxygen, which is a really drying gas, right? You see all the issues that go on when they're using oxygen. So it's going to help alleviate all that. So comfort, and it's going to help just make the therapy more tolerable. So that's the whole heated humidification part of it. And then also when you're on oxygen or you're just at home, again, you don't need to have oxygen with this. You can run it without it. But they start getting secretions, and they start building up where they need to spit up all these secretions, and they're getting a lot of congestion and a lot. So by delivering 37 degrees at 44 milligrams or high levels of humidity, it's going to help loosen up those secretions and help bring those up in a productive cough for that patient, right? So again, all about comfort, the pneumonia, all the other stuff that's associated with these patients. They're already at that point in their lives, but this is just going to help alleviate maybe a lot of those issues that they come across. So that's one part of what the device does. It's that humidification. The other thing it does, it provides flow. Okay, so it provides flow, and it goes anywhere from 10 liters of flow up to 60 liters at home flow in the home. Okay, now if you look at your chart on here, you're going to see the different flow settings across. Okay, it'll say flow settings 5, 10, 15, 20, 25, 30, all the way across, right? So that's what I mean by flow. That's not oxygen, right? That's just the flow. That's not the FiO2 or the fraction of oxygen. That is the flow. So this is where things get different from the hospital in here. So that's why Sam was reiterating that when you go talk to the discharge planner or whoever's sending that patient home, you want to be able to see what that Airvo is set in the hospital, because they typically use Airvo in the hospital. Okay, what's the flow? Okay, it's at 30 liters. Okay, so that's the flow. How do they determine the flow? Typically, you want to meet or exceed the peak inspiratory demand of the patient, okay? And what that means is that you're basically giving them enough respiratory support so they're not gasping for air, right? And that it's just helping them with that normal breath, okay? So what that's going to do, again, comfort. They're not going to be gasping. It's going to help them relax their breathing, right? It's going to help them. It actually provides a little bit of PEEP, so you get a good lung expansion there, and that's going to get a better gas exchange, so you're going to be more oxygenated. And then what it also does, that flow washes out that CO2 that's trapped in that upper respiratory tract, okay? So you wash that out, you get better gas exchange, right? And then a person that's not on, that can help, a person that will benefit from this respiratory support, you see them, they're breathing really shallow breaths, right? Their heart rate's rushing, they're struggling to breathe. By adding in this respiratory support, again, it's going to slow down their breathing. They're going to get deeper breaths. It's going to relax them. Their heart rate's going to go down. They're going to be a lot more comfortable, okay? So again, how do you set that? The therapist is going to work with the discharge planner and get that set. And it could be anywhere from 25 to 60 liters, but typically your average adult male is like probably 25 to 30 liters. So that's always a good starting point. And if you did have it on and you notice that they were gasping, right? Like they needed some more, you can call your respiratory therapist. Respiratory therapist will come out or do whatever they're going to do to maybe turn it up to help supplement that, okay? Or if you can't over titrate the patient, meaning if they needed 30 and you gave them 40, you're not going to harm the patient because it's an open system. It's not a closed system like a CPAP, right? So it's gonna, any excess that you give the patient, it's just gonna blow out the sides of your nose. The body only will take in what it can take in, okay? So you don't have to worry about over titrating that patient too as well. Yeah. Okay, no, okay. So you've got the flow for respiratory support, help with the work of breathing. You've got the humidification, right, to make it comfortable overall. And then the last thing, you can use it with oxygen, with or without oxygen if needed. The machine has a blender and an analyzer into it. It can hook up to your basic 10-liter concentrator, okay, or bottled source too as well. Now you don't have piped in oxygen in the home setting, so you're either going to be on the concentrator, which I think Sam will use, or bottle, I guess, in the case of a backup. I don't know, but it'll blend it, it'll analyze it, and it will show you what the FiO2 is on the machine. Okay, am I making sense here? Okay. The other thing that's great about it is when it delivers the flow or that gas to you, there's 3 different things that it can do. So you typically are going to see a nasal cannula, right? So you have the nasal cannula. Great thing about it is a lot of times these patients that need a little bit of that respiratory support, they're on a bilevel or a BiPAP or a CPAP. They have a big mask on their face. It's tightened down. They're getting pressure sores. They can't really communicate with their family. This right here, you can have this on, helping them, give them that respiratory support. They can talk to their caregivers, their loved ones. They can have a drink. They can eat. You can do everything on it, and it's just a lot more comfortable. You have that full freedom of vision. It's just a lot nicer for that patient. So that's another aspect to it as well. And then right now it is on. So it's on right now, and it's at 35 liters of flow. So quiet, comfortable. It's not giving off all this heat. And here's the unit. I mean, it's just, this is it. So it looks like your standard CPAP machine. There's nothing much to it. So it's very simple and easy to operate. So those are the three main mechanisms that the device will help out with those hospice patients. Okay. What else?
On the flow chart,
Yep.
on the left side
Yep.
is the oxygen flow, the supplemental oxygen. So 1 through 15, and the manufacturer suggests no more than 15 liters of supplemental oxygen.
Yeah.
So if we do get a case with 15 liters, we'll provide 2 10 liters to get that 15 blood into the airway.
I'll go over this chart here. So this is where everything gets discombobulated between the hospital, the discharge, and the home, because the Airvo can provide 100% FiO2, but you don't have an oxygen source that can do that. Does that make sense? So at the most, you're gonna be able to bring 15 liters of oxygen. And whether that's these 2 10 liters combined, so that's what you gotta first look at. So the main thing is, again, communicating with the therapist and finding out what is the flow. Okay, what is the flow? How are we meeting or exceeding that peak inspiratory demand? And I think you even have them like a prescription that you use or a chart. So you want to find out what that flow is, and then you want to find out what their FiO2 is, right? Or because they never talk like in liters of oxygen, right? They never say, "Hey, we're running 5 liters of oxygen." They're saying we're running 30%, right? And we're at this flow. So it's kind of like a math equation in here. They go, okay, we got a 43% FiO2 and we got them on 25 liters of flow. So we just kind of look there and we go, oh, okay, he needs 7 liters of oxygen. Does that make sense? And this is what the Airvo can bring in the home setting. So if they're telling you an FiO2, you got to make sure you get the flow too as well. Because they can say, hey, we're bringing 90% FiO2, and you're looking at FiO2, and you go in your chart and you go, hey, I found it, 90%. But they're only at 10 liters of flow. That's for a baby. I mean, that's for a kid. No adult male, that wouldn't be enough. The patient would be gasping, okay? And how it works, if you don't know, is that if you have your flow rate, if you look on your chart, so let's just take an example here. If you look at your chart on the top, and you'll see 20 liters, right? That's 20 liters of flow. Make sense? You see that? Mm-hmm. Now, if I bled in 8 liters of oxygen, what's my FiO2?
53.
What is it? 8 liters at what?
It's 53.
53. You see that? Okay. Now, if I kept it at 8 liters and I bumped it up to 25, what does my FiO go down to? See? You see what I'm saying? So if you keep your liter oxygen at 1 and you add in more flow, you dilute it, so your FiO2 or fraction of oxygen will go down. Okay? If you decrease the flow and have it at the same setting, oxygen setting, your FiO2 will increase. But by doing that, if you're not meet or exceeding that peak inspiratory demand that patient needs, you're only hurting the patient because the patient is gasping. You want to be able to make sure that they can able to, give them some good respiratory support. So that's kind of what you want to look at. Does that answer some of your questions or help out? So that's what you kind of want to look at. You want to make sure you get those 3 numbers down. And I mean, you want to make sure you give them enough respiratory support. That's really important. And I know the hospital and the pressure that's on you all of, hey, we want to get them out of the hospital. We want to turn the bed, all those great financial things. But then again, we have the family that wants to get them home. There's a lot. So you need to make sure that you get them on that setting. They're stable. They're able to handle it because we still got to get them home. right? You still got to transport them, and whether it be you don't want to make sure the person's crashing. You want to make sure that they at least can handle these settings and are SpO2s, all their oxygen saturations are at that point, and they're not struggling, that they can make it get home. So that's my only thing, is that you go into, like Sam said, you can't go in the hospital, make sure you kind of mirror those settings as best you can with what you have in the home. And the respiratory therapist knows it and knows what you can do in or out of the home. And it's not home oxygen, it's the limitation of the oxygen that you have in the home. That's what it comes down to. So that's what you're looking at. And then the Airvo 3, which Sam spoke about, there was a situation, I guess, where the hospital uses our newer version, which is the Airvo 3, and they wanted 70 liters of flow. Well, this Airvo only goes up to 60. So that's all it does. I don't know what that 10 liters, how much difference that might have made. I would have said, hey, can you titrate it? I would have asked them, hey, what's the FiO2? What are you running? But hey, maybe let's titrate him down. Can he handle 60 or 50, right? And then kind of go from there and see how the patient does. There's got to be a two-way communication, both of you. Otherwise, you both are going to be just kind of all over, going back and forth in circles. So try to get it up, like Sam said, try to get those settings right away as best you can, and that will alleviate the back and forth and just get everybody on the same page. I know it's tough, but that would be my recommendation.
So if they're running, let's say 60 liters of oxygen, they can do the 40 FiO2
Well, no, 60 liters of flow.
flow.
Are you saying flow, right?
Well, yeah.
Yeah.
Like when I was at VTOS, we did 60-40 or 40-60.
So you did.
Standard.
So if you were doing like 40 liters of flow,
Yeah.
and you had a 60% FiO2, you would be running more than 15 liters of oxygen. So that's not going to happen. If you did a 60 and a 40, that means you would have. So if you did 60 liters of flow, and you had 14 liters of oxygen, which you can do, your FiO2 would be 40. Yep. So you could do it that way.
So they would do 2 10-liter.
Yep. Yep.
Yeah,
10
so-
liter.
That's what he was saying that they would do for you two as well. Yep. Mm-hmm.
So that's 60-40 we can hear.
Yeah. But again, if the patient doesn't need 60 and they're giving them enough respiratory support on 40,
Yeah.
then
no,
you're fine. So
Trust
just,
me,
yeah.
we got one out of the hospital.
Yeah.
It was going to be 60-40 and
Yeah.
didn't even need the Airvo ones.
Yep. No, and that's where the confusion comes. You said, "Oh, I need to run 60%." You're like, "Well, 60. Are you talking about flow, or are you talking about FiO2?" See, that's where that kind of thing comes in. Definitely, yep. And then if you wanted to, on the app, if you go into the app and if you went into the Airvo app, I'm trying to find mine on here. Okay, Airvo 2. You can actually play around with the oxygen. So if you turned it on, and this is like a tool you can play around with to see if you can even do it at home. So it goes Airvo 2. And if I go oxygen, if I turn up the oxygen, this can go all the way up to, I would say stick it to 15. It'll go higher than that. You can do, and let me increase the flow. Hold on. Go to flow. Going to increase the flow. But you can play around with this app and you can start. So if I went up to 60 and then I put in 15 liters of flow, you can see it's at 48 right now. That's just kind of what you can do on the app to kind of see, hey, will this patient qualify, if you understand what I'm saying. So you can do that too as well. So you do have the app for another little tool, but this chart will be
Two here again. I need to.
will be suffice for you. It'll tell you everything.
So there's this one up here and this one down here, which is the actual one.
My Airvo.
You can do Airvo 2.
It's the My Airvo.
Do the Airvo 2. Do this one. Yep.
This one.
Yep.
Do mine.
Okay.
Do Airvo.
Do
Because
the one
that's
that
your
just says
settings on
Airvo.
it.
Not.
Yeah, look at Airvos for the app, not My Airvo.
Okay. I want to make sure I have the right one.
Am I helping here or
Yeah.
getting what you need? Okay, good. Good. The device itself, how it works is you have this is it, like I said, it's on. So you have a flow generator. So it's generating flow. It's taking in room air, and it's passing the room air over the humidifier chamber. The humidifier chamber is picking up all the humidity, and it's bringing it down this heated circuit, okay? And this is the circuit that the patient goes to. And then you have a cannula that connects to it like this, snaps into place, and then you could just put it on over the head and put this into the nose, and you're running your cannula. Or if you're trach, which you guys pretty much probably don't do, you can hook trach up to it too as well. So you got your two different trach interfaces. You have one that goes directly to the trach. And then you have one if they have a trach collar that has a 22 millimeter connection. And then you have your, again, your cannulas, right? So,
Small, medium, large.
yep, small, medium, large. There's 3 sizes on the cannulas.
So we typically take all 3 sizes on the set when we dispense the air.
The machine does, and again, you'll see, if you look on the app, it's hard for me to show you from here, but you can adjust the temperature. So there's 3 temperature settings on the Airvo. There's 31, 34, and 37 degrees. That's it. Turn it on. If you start them off at 37, that's what I would start them off on, and it's too much for them, it's too warm, go to 34. 34 is too warm. It's all about comfort, right? If they have it on and they're getting that dryness, that congestion, and they're at 34 or 31, turn it up to 37, okay? Or just turn it up. It's all about comfort, and that will change. You know, might get colder, might get warmer one day. They might want to change it. So, and you're able to change that heat setting. So that's all about the comfort. Again, anything with the flow, if the patient starts to, you know, gasp or need more respiratory support, or they have questions, that's when you would get a hold of the RT, right? You get a hold of Sam and his staff, and they're able to make adjustments. So the only adjustments are the temperature, humidity, and then if oxygen is needed and you need to adjust the oxygen up or down, it's done at the concentrator, not on the machine, okay? So you adjust the concentrator up, that will lift up the liter flow, and then it will show you what the FiO2 is on the screen, because it'll blend and analyze it for you as well. So it's all there. There's alarms on it too as well. And what I mean by alarms, they're really helpful alarms. Meaning when it runs out of water, it'll beep and it'll say beep, 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 add water. You add water, put it in, the alarm will clear. If it gets occluded, let's say if the patient rolls over on it and it gets occluded, or the things bend in their nose, it builds up back pressure, which it's doing right now, and it will alarm, and it will have a picture that actually says, hey, check for blockages. And then once you fix it, you'll hear a minute. There you go. Now the alarm cleared, the machine, the blockage is gone. So it'll have that. If you left the oxygen on and turn off, so using oxygen, don't have to, but if you do, it's like a CPAP. Turn on the machine first, then turn on the oxygen, right? Turn off the oxygen, then turn off the machine. If you left the oxygen on and you turn the machine off, the device will tell you, hey, turn off the oxygen, because it can analyze that it's building up too much oxygen in the device itself. Cleaning and maintaining it, I think the cannula you give them, what is it, the last couple weeks, or however you do it?
It lasts 3 weeks.
3 weeks, so, and that's usually typically good enough for them. You have water, you have your water source here. You just pull it out. It's as easy as turning it on its side, filling it up to the black line here, turn it over, and it'll be up to the fill line. And then
use a special water.
we recommend distilled water, but again, in this situation, I mean, if you use distilled,
We say distilled, but I know you said they could use bottled water.
Yeah, I mean, if they're in a pinch and they need something, right? I mean, sure, but yeah, I'd always recommend distilled water. And the reason for that, it's not for disease or anything like that, or it's going to bring over anything, and I'll get to that in a minute. But it just keeps the life of the chamber longer, because especially up here in Sacramento, where we have a lot of hard minerals in the chamber, it'll start to break down the chamber, and then it can leak, and you get all that white calcified deposit on it. So that's something. Another people will ask is like, oh no, you're sending water over to me. I'm going to get an infection. I'm going to catch pneumonia. All that. No, you're not. The reason why is with the Aerovone, our humidifier, this is the same humidifier they use in the hospital, in the ICU, same base, okay? We're bringing over molecular humidity, which is very small. It's like 0.001 micron, very small. A bacteria or a virus is much bigger than that. It's like 0.10 and higher. So that virus or bacteria, it's physically impossible for that water vapor to carry that virus from that chamber to that patient. So yeah, you're not going to worry about that. Yeah, you don't have to worry about that. You're not going to catch a cold using it. If anything, it's getting all that stuff out of you, not trapping it inside you. Another thing, if somebody, like, you know, one of your nurses out there and they can notice, man, this guy probably can benefit from the Aerovo, lady, and you put it on and all of a sudden all this stuff starts coming up, that's a good thing. People sometimes get freaked out and they go, oh, turn it down. This is not good. No, that means it's coming out of you. They're coughing more. It's not they're sick. It's loosening up those secretions and bringing them out, okay? So that's the other benefit, too, of it as well. There's a filter on back. It lasts 3 months or 1,000 hours or 2,000 hours, so you don't have to worry about changing it. If you do, they'll take care of it all for you. The tube just comes off like this, okay? And if you inadvertently took it on and it was on, it's going to alarm and tell you. And then you just put it right back on. That's all there is to it. And then when you turn it off, you just kind of want to hold it down, press it down, and it'll turn off. Now the alarm, there's a mute button up here too as well. And if it's beeping and it's disturbing the patient, maybe they're sleeping, the alarm went out, you can just hold it down. It'll mute it for 1 minute and 20 seconds. Or 2 minutes, I think it's 2 minutes, so it'll do that, yeah. Trying to think if there's anything else.
Just the oxygen bleeder?
Yep.
Where it gets connected?
Yeah, so Sam has on the oxygen, you know, if he has it on, here's where it connects, okay? So it just connects here to the side, and all you want to do is just set it like this. So this is your standard oxygen tubing. There you go. And now, if you turn it on, right now, if you look at the screen, if you don't want to come up here and take a look, I'll show you. But it'll have the setting, the temperature, the flow, and it'll have, right now, it has 21% FiO2 because it's running room air. So, yeah, if you want to show it to them that way.
I was gonna try and flip it, but
Oh, it's not because this one is came to this one.
I'm recording on this one.
So yep, those are the settings, and you can see the FiO2 hasn't gone up yet. You've got to give it some time, but it's got to run its course.
I'll just do this in here for the recording, and then I'll take the other one.
So it's very useful.
So for the YouTube, I know you said you take out what's the channel for?
Well, just our
Is this yours for home oxygen?
the home oxygen
Oh,
company.
okay. Got it.
So we're almost done with the video for the Aerovo. But like I said, our oxygen systems have our QR code.
Yeah.
I think our hospital beds have it on the headboard or footboard,
Right.
just in case someone's there and they don't know how to lower the half.
Does that answer some of your questions? Did I explain it?
I have a question.
Yeah.
Why would a patient use that without oxygen?
Because again, so the other benefits of it are the humidification, right? The help bring up those secretion oxygen if they're not using oxygen, but if they got a lot of congestion, that. But the flow, it's that flow. That's for respiratory support to help with the work of breathing, right? Instead of, yeah, that's nice, right? And it's going to help. It's going to help them with their work of breathing, definitely. Lower their heart rate, make them feel a lot more comfortable. They're not going to be gasping for air as much as well. And then if they're on a CPAP, I mean, this is a lot more better because you're not closed off to the world. So, yep.
Eat and drink.
Then you can eat, yeah, just all that. You're just a little bit more free. Does that make sense?
And are we specifying when we order it what tubing along with
The tubing?
airflow? Yeah.
No,
Or
you
the-
don't-
Or
it's-
they all come with it?
Yeah, it all
Yeah.
comes with it. If
Yep,
there's
everything will be
supplemental
set up
oxygen,
and ready to go, yeah.
if there's supplemental oxygen, there'll be tubing that will be attached from the concentrator to the Airvo. And then if they don't want to use the Airvo, they'll use the concentrator, they'll have a cannula. A nasal cannula for oxygen versus the cannula for the Airvo.
But again, I think the benefit of if they're on oxygen using that airboat because of that humidification, and along with that using that flow to help them with the work of breathing is definitely good.
So we have a question. I know you said if it's kinked, it will beep, but what if it come off the patient? The nasal cannula?
It's just
Will it
gonna
beep as well?
no, it'll just be
Okay.
on. Yeah,
Okay.
it'll just run.
Alright.
Pretty sure, yeah. I haven't tested that, but yeah, I'm pretty sure that will just.
Just wondering, 'cause you have some patients that
Yeah,
say
no,
they're
yeah,
on board.
yeah.
Yeah.
Only if it's obstructed,
Yeah.
or the tube comes off of the top up there. Is what it will. Yeah, because I've had this off like this, right? I've had nothing on it. And it's not alarming or anything. If
Okay.
you want to feel the air, you can feel how warm it is if you're into it. I mean,
Pretty warm.
Oh,
yeah, it's
Is
nice
it?
and warm. Yeah,
yeah, this is
Yeah.
like uncomfortable hot.
yeah.
No,
And again, this is at the highest setting, so you can turn it
it's
down.
like body temperature level for me.
Do you, do you
Yeah.
order a lot of BiPAPs or CPAPs at all? No?
A lot
That
of
would
our
be-
patients come off the CPAP once they admit it, but some of them will still use it, so we haven't had a lot of.
Because like Joe said, the difference is with CPAP, it's continuous positive airway pressure versus flow, so pressure versus flow. But I do know, sorry, on the BiPAP, like the STs, there's a mask alarm. So if the mask were to come off on the BiPAP, the device will actually alarm. And then coming out of facilities, I'm sure there's one here, it's called critical transport, because the airboat doesn't run on a battery. So if the patient's gonna be transported from a facility to the home, the critical transport units actually provide airboat versus just a standard ambulance. So if you haven't used that, you might wanna check into that.
And that's again another thing to get them home, the same settings.
I'm sure
They don't
discharge
cr-
manager, case manager probably knows for critical transport, as far as providing the airboat during transport home.
Yeah, again, it's a new. I don't know if it's new to you, the airboat, but it'll take you a couple times once you get it down. But again, I think to Sam's point, can't stress that enough of getting that initial interaction, getting that communication down right away, and just kind of walking through that. That's gonna make your lives and everybody's lives a lot easier. And Sam has his order form, so I mean, I think you can even look at that,
Yeah.
right, as a guide to even ask, what would be good for
I didn't bring it, but I'll
That's
email
nice
it
if
to
you had it.
Melinda.
Okay, yes, that'd be great.
And like Joe said, it's just a guide. It'll actually cover the flow, settings, which are comfort, and then if there's supplemental oxygen, so it's kind of basic. It'll help out.
Yeah, like I said, a lot of times, like before a ventilator patient gets just, home, a lot of times the company kind of goes up there, kind of sees how they're doing on that, mirror those settings to the airboat, right, Sam's? That's the kind of concept you're looking at doing, and then there you go. Yeah, making that call.
It's very helpful.
Good.
We have a recording, so the nurses that couldn't be here.
Yeah, and again, we're always here to help. Sorry, Sam.
Yeah.
We work together all the time, so.
Okay.
Yeah, if enough notice is given, we can definitely help out. There's all kinds of YouTube videos, but and that type of stuff out there. A little same concept, but you get
The
a
app,
basic
the app's
idea.
useful. Like I
Yeah.
said, you can do tutorials on the app.
Yeah,
Okay.
yeah,
Yeah.
It gives you hands-on without having a device in front
I
of you.
saw that.
yeah.
Thanks, Joe.
Everything.
Are they muted? I don't know if they had any
Lisa, are you gonna send out the paperwork along with this training since we're not there, or is somebody gonna send it like via email or something?
Yes.
Yes. We will scan one in and send it to everybody.
Did you have any questions?
Yeah. Does anybody have any questions? Sorry.
No. Thank you.
Pretty straightforward.
She's like, nah.
Yeah, the device is simple. They're using the CPAP. Again, there's nothing
And that thing.
to it.
Especially with the mask.
Yeah,
There
exactly.
is no mask.
Yeah, there is no mask leak. Hey, you don't have to worry about the mask.
Right.
And all that other stuff that comes along with it.
Losing suction.
What's that?
I think it's just, I'm just saying, it's more determining whether or not they need high flow or low flow.
Yeah.
Yeah.
Well, I mean, what's their comfort level? What do they need, right? And everybody thinks it's high flow oxygen. You have to do oxygen. You don't need to, with or without. If you feel they can benefit from that added respiratory support, a little bit more PEEP, better gas exchange, help with the work of breathing, you're good. And then the humidity for the comfort.
Thank you all so much for coming out.
You're
Really
welcome. Thank you.
appreciate it. Yeah.
Enjoy the weekend, huh?
Yes, y'all too.
Yeah.
Wait, today's only Wednesday.
No, it's Wednesday. Well, you know why I'm saying that? Because I'm going on vacation tomorrow.
Oh.
Yeah. My vacation starts